Bars and restaurants were allowed to reopen on June 8th with the restriction that they use no more than 50% of their capacity. Well, now 2 weeks later, the Ingham County Health Department has issued a notice about an outbreak related to an East Lansing bar. Dr. Frank McGeorge joins us with what you need to know. Doc?
Yeah, Kim. Well, as society and businesses re-engage in public activity, the ideal is that with precautions, there wouldn't be any additional spread. But frankly, as a realist, I would anticipate a degree of increased transmission. That is where public health comes in, identifying hotspots and getting the word out so those flare-ups can get corrected. The Ingham County Health Department says at least 18 people who recently visited Harper's Restaurant and Brew Pub between June 12th and 20th have tested positive for COVID-19. They're advising people who are at the East Lansing establishment in that time frame to watch for symptoms in the 14 days following and get tested, even if you don't have symptoms. The health department found Harper's was following safety procedures related to capacity and table spacing, but
while that was the case, there are numbers of people crowded, and you're going to expect this at a place like that, crowded up at the bar, hanging out together.
There is also concern about crowded lines outside.
There was a sign about mask wearing, and it's very clear from the pictures that that didn't happen.
Harper's voluntarily opted to close temporarily late yesterday to implement a program to eliminate lines and to modify its HVAC system.
We clearly cannot be in every bar, every restaurant, and every other business every day looking at mask wearing and looking at social distancing. So we need some help. We need help from businesses and we need help from people.
So far, all of the people with cases linked to Harper's are between the ages of 19 and 23. About half are connected to Michigan State University. Some are from other counties. Now, this particular situation really highlights the important role that every individual has to decrease spread. Maintaining distance, mask use, and hand washing are always necessary because of the risk of asymptomatic and pre-symptomatic spread. Now, once a person, of course, has symptoms, they should certainly get tested and stay out of public contact.
Doc, you mentioned the bar was modifying its HVAC system to reduce the spread. I'm wondering about your take on the claim from that Arizona megachurch where President Trump is having a rally today. They say their ventilation system kills 99.9% of COVID within 10 minutes or so and is therefore safe. What do you know about that?
Well, there's a few elements to that. First, keep in mind that some transmission, of course, occurs through surfaces. That's not the majority of spread, but it's certainly enough that hand hygiene is important. And of course, ventilation systems will not remedy that source of spread. So the church says they are using an ionization system to filter the air that is circulated through their ventilation system. Now, ionization systems work by electrically charging particles in the air that pass over an electrostatic filter that they're attracted to, and it pulls those particles out. Now, while I obviously don't know the details of their system, the real issue is that while filtration and ventilation is really important to reduce indoor transmission, it does not prevent larger droplets or fine aerosols from spreading within the immediate area around an infectious person. So I would have to give this a be careful on the trust index. Frankly, filtration and ventilation are just one element of mitigating risk. Masks and distancing are always going to be important and still are here. Back to you.
Yep. Thanks for sorting it out for us, Dr. McGeorge. We appreciate it.